Our next session, once again, brings another aspect to the presentations we've had today and yesterday. And I have pleasure to introduce Jacques Barnard. Jacques, a doctor. So Jacques joined Vetoquinol as farm animal manager for Australia and New Zealand in October 2022. Jacques is an experienced cattle veterinarian who commenced his career in South Africa before moving to New Zealand in 2008. There he had a long tenure with Bomac Bayer Elanco, animal health and roles ranging from marketing manager farm animals, regional species manager dairy, director, brand maximisation and regional innovation Australian Pacific. Jacques joins us today to discuss what's new in synchrony programs in pasture-based dairy herds. Please welcome Jacques.
Well, firstly, I'd like to start off to say that unlike Matt, who's been to every herd conference before, this is my first one. So thank you to NHIA for the invitation. And I'd like to say a few words around synchrony programs. I don't know if new is that new. It's sharing a bit of data that's been around, kicking around sort of for the last 5 to 8 years. But I'm more of a company man than a farm boy. So for me to understand things, I've got to make it real simple. And I'm going to try and make it simple or easy for you guys as well. With the idea of bringing about 12 trials that has been done, 6 overseas and 6 locally, back to what is practical for us as service providers and as veterinarians to advise our customers. So we'll start off with the summary. I'm going to start off at the back end of my presentation because it might be the only bit that you remember. And so that is, if you look at a standard of-sync program or a synchrony program, you can change that to a fertility program by simply adding 1 extra injection of prostaglandin on day 8. And I'll explain the difference a little bit, what's the difference between a sync program and a fertility program. But you can increase pregnancies per AI by the trials which suggest anywhere around 5 to 15% pregnancies per AI by a single extra injection. Sounds too good to be true, right? We'll have a look at the data. Before we do that, I'd like to start with a little question. Who's brave enough to guess what does the animals on the left have in common with each other that the ones on the right don't have? Anybody brave enough? Say again? Correct. Well done. So the ones on the left are induced ovulators. Why is that important? Because the act of breeding induces ovulation. The ones on the right, the ones we are interested in, spontaneous ovulators. So we don't quite know when that is. Hence, the need for synchronization programs so that we can bring them all together and so that we know when ovulation happens. In other words, when breeding should happen. So if you go back, this all happened basically in the mid-1990s by Professor Richard Pursley. He was one of the great pioneers, and he basically coined the of-sync program, which many of you will know. It's a 10-day program. You start off with a GnRH injection on day 1. 7 days later, you give a prostaglandin injection. 48 hours later, you give another GnRH, and then you breed the animals. And so that synchrony program increases the risk of them being inseminated, but it does not necessarily increase the risk of them becoming pregnant. Now, why is that the case? Because if you look at improving fertility, you require 2 things. On the left-hand side, then we're going to try the pointer. If your heat detection or heat observation is pretty average at 50%, and conception rate is standard but pretty good at 50%, you may get 25% pregnancy rate. If you improve your heat detection and you submit 80% of animals, and I'd say that's probably pretty good, your conception rate still is only 50% because it's not influenced by your AI program, but your pregnancy rate jumps up to 40%. And even if you submit 100% of animals through the use of fixed-time AI, your conception rate is still the limiting factor and your pregnancy is only 50. So wouldn't it be nice if we could all do something around this conception rate rather than just on the submission rate? Now, that conception rate is influenced by many, many factors. The one that I would like to point out today is progesterone levels. And of course, progesterone comes from the corpus luteum. Now, when a cow ovulates, she forms a new corpus luteum and the progesterone levels rise. And then in order for her to ovulate again, there needs to be luteolysis, so the corpus luteum goes away. And when that progesterone levels is low, she can ovulate and hopefully fall pregnant. But it's important to realize that the corpus luteum is only susceptible to prostaglandin for a few days, somewhere between day 5 or 6 and day 16. A young corpus luteum, this part over here, is not susceptible to prostaglandins. So really what I'm proposing here is a number of programs and interventions where we try and get rid of the corpus luteum at the time of insemination. In other words, we want low progesterone levels so that the cow can actually fall pregnant. And we'll see how this is important. So here we're looking at progesterone levels in the blood, and you can see that if the progesterone levels are quite high, here at 0.6, then we get about 20% conception rate. But if we can halve the progesterone levels down to this level, you can see that the conception rate doubles. So really, to get to that magical number of about 50% conception, we can see that you need to get rid of the progesterone. You really want to have low progesterones at the time of AI. So all the corpus luteums has to be gone. So one of the approaches to get cattle all at the same stage in their cycle is by using pre-synchronization protocols. So on the top here, you can see there's a pre-sync program here, followed by an of-sync program. In the bottom, you've got another trial group of animals. This is 2 different experiments done by Milo Wiltbank in the US, looking at the difference of using 2 doses of progesterone. So one on day 7 and another one on day 8 of the program, compared to just using the standard injection on day 7. And what Milo found was that if you look at pregnancies per AI, if you use a single prostaglandin, I should say, sorry, they had pregnancies around 34%. By using the 2 injections, so one on day 7 and day 8, that jumped up to 37%. So an increase in pregnancies of around close to 10%, merely by adding a second injection on day 8. And they concluded that this is likely to be a very practical treatment for many dairy farms. And the hypothesis of the theory is because they got rid of more of the corpus luteums, the young ones, by doing 2 injections on day 7 and day 8. So what I'm sharing here is a bit of a meta-analysis. This is across 6 different publications, mini herds, around 1,850 animals included here. And you can see, depending on the different studies, all of them giving a positive result or a higher relative risk when you're comparing one prostaglandin to the 2 prostaglandins on luteal regression. So utilizing a single PG, you get rid of about 83% of corpus luteums. So these animals are susceptible to conceive. If you use 2 PGs, you can see you get 95%, so it's about a 13% improvement, around that ballpark number again of, say, 10% improvement. The next study that I'm referring to is very recent work out of Germany. It's a slightly different study in that they compared the same 2 injections on day 7 and 8 over here, but they did this in animals that also had progesterone devices included. So this is not a standard of-sync, it's an of-sync plus a progesterone device, something that we would normally advise for an estrus cattle. And at the same time, they also compared, instead of giving 2 PGs, what happens if we just give a double dose, but still on day 7? Would that have the same effect? And they concluded that 2 PGs compared to the control group of 1 did increase luteal regression. And you can see the pregnancies here at 35 and at 80 days was 46% in the double PG group compared to the controls at 37, so about a 9% improvement. And that was all the way through confirmed again at 80 days pregnancy confirmation. So again, a 9% improvement. The double dose on day 7 did work, but not quite as good. And I guess for me to understand, it's pretty easy to think about it based on first principles. Prostaglandin is a very short half-life. We're talking about minutes. So when you inject the drug, within minutes it will have the effect, but within minutes it's also paid out. So by giving a double dose, you extend that by a few more minutes. But it doesn't really have the effect like coming back the next day and picking up some of those CLs that are now more mature. Now that's all interesting. That's all about cows overseas, but what about cows on pasture? So bringing it back home. This is some local work done by Joey Reinberger and David Beggs and others. 2015, 2016. They had a look at 5 split calving Victoria herds. And the only thing that was different between these groups of animals, so they had about 850 animals enrolled. They had an original of-sync group here, and they had this modified off-sync group, which is only the extra PG on day 8. And what they found was that the modified off-sync group, conception rates were 7% higher, and the odds of conceiving to fixed-arm AI was 1.36, so 36% improvement. And the reason or the explanation was that they could get rid of the remaining progesterone. So in the original off-sync group, where you just do an injection on day 7, this is at day 7, you can see the high progesterone levels there. At AI, we still had some animals with high or elevated progesterone levels, suggesting that they still have a CL. But in the modified one, at day 7, we injected them again at day 8, and you get rid of all of that remaining progesterone. And all the animals is low in progesterone, and so you get improved conception. So the conclusion then was that that additional PG on day 8 does increase fixed-arm conception. Jumping across the ditch to New Zealand, this is work done in 2018, 2019 by Scott McDougall and others. And this was in anestrus cows, again an off-sync program, but it did include a progesterone device, the only difference being a double PG or a single PG. And Scott's results confirm with all the other studies, so highly significant results, firstly from a stats perspective, but about a 4 to 5% increase in conception to AI, as well as 3-week and 6-week in calf rate. And so Scott concluded that the addition of that second PG 24 hours after the first increased conception rate and the proportion of cows pregnant by 3 and 6 weeks. So last study was work that we did last year in New Zealand with our products. This was in 2 Waikato farms. We enrolled about 461 animals, and we had 2 groups. Again, the only difference between these 2 groups was the addition of an extra prostaglandin on day 8. And the results that we found was that that double PG injection performed significantly better. If you look at the pregnancy rates on the double PG, 47% compared to the single PG, 34%, a pretty low result. So an improvement of about 12.8% by simply adding that extra PG. So my summary back to where we started is that in order to improve fertility, of course, we have to increase submission rates, and there's a lot to be said about that you can do to make sure that that fixed-arm AI works and that animals are correctly identified and put up for breeding. But in terms of increasing conception rates, one of the simplest things I believe that can be done is just including a second PG 24 hours after the first one. And that really allows you then to take what is a synchronization program into a true fertility program and actually making a difference. And with that, I am done. Thank you. I raced through that, but I hope that...
No, I really appreciate that. So I'm just wondering, any questions from the floor? Slido, I have a sneaking suspicion there may be a few gentlemen and ladies in this room might be happy to have that discussion if they haven't already had some discussion around something that's been a very important part of the industry for a serious amount of time. So, and there's a lot of always different opinions.
Maybe I can ask the audience a question if there's no questions. What percentage of the audience is currently using, advocating, or I guess promoting a double PG? Is this known practice? Is it something? Yep, so I can see a few hands. Right, so that's pretty good. So I guess it's just confirmation from our side that it's something really easy to do, and it's been well researched both overseas, locally. The data also that I presented is interesting to point out that it's many different sources of GnRH use, different prostaglandins, different progesterone devices. So it's not specifically related to our products or to anybody else's products. It's more about the physiology and understanding that if you can get rid of those CLs, you're going to get a better result.
Jacques, you may be better to read the question from Majid because the ECG-PGF2 instead of you may be...
A nice talk. Is there any restriction for using an ECG instead of 2? I think there's been some work looking at the comparison of using ECG. My understanding of ECG is it does allow you to grow a better follicle and you'll get a good result, but you're addressing a subgroup of animals compared to double PG. So in both of them, you'll see an uplift in conception, but it's for a different reason and it's a different subgroup of animals. So in New Zealand, we used to have ECG, we still have. I personally used to distribute an advocated product of ECG, Pregnicol, that we had back in the day. And when we lost distribution of Pregnicol, when it was taken off the market there, we had to switch, right? We had to find a solution, how could we help? And one of the investigations was around a double PG. And in the end, we could show that you get a 6 or a 7% improvement on a standard OV-sync, but they work for a different subset of animals. So you can get a similar result. The question really would be is if you used ECG in addition to the double PGs, would you see an even bigger result? And I unfortunately don't have any data to say that. I think it's something we might, Rob, I see you shaking your head and saying, no, you don't think so? Right. Yes, I don't know if anybody's really looked at that. I hope that answers the question, Majid.
Okay. Well, thank you very much. It's been a pleasure and all the best.